This is a Sigma Spectrum IV pump used at this facility. Before you spike your IV fluids, attach Curos caps to all open ports on the IV tubing. Spike, hang, and prime your IV fluids. Power the device on using the on-off button. Find the blue slide clamp and push it into the slot on the top of the unit. The slide clamp will only fit into the unit one way. Once the door pops open, press the IV tubing into the channel. Be sure to leave some loose tubing at the top. You should get 3 green check marks before closing the door. If the 3 green check marks do not appear, press the number on the channel corresponding to the red load section. Then close the door. Use the up or down arrows to select your specific care area. ED, ICU, PCU, PACU, and Cath Lab will use special care area. MedSurg Tele will use general nursing. Once your area is selected, press the OK button. To program IV maintenance fluids, we're going to enter IV into the pump to program a 1-liter bag of 0.9% saline. These pumps utilize T9 text for word entry. That means you will have to push the number 3 times to enter the I, and then push the number 8 one time to enter the V. This selection will pull up all the available IV fluids at our facility. If you cannot find a drug or fluid in the IV pump for your selected care area, that is a good indicator that it may be some IV fluid you should not be giving. It is recommended that you contact pharmacy or your charge for further guidance. Scroll down to IV 0.9% NaCl and press OK. We will enter the rate at 25 mL per hour and then press OK. VTBI, or volume to be infused, is 1,000 milliliters. Press OK. You will notice the pump automatically calculates how long it takes to infuse the volume. Please take an extra second to make sure this number makes sense with what you programmed. Then remove the blue slide clamp at the top of the pump. Press Run Stop to start your infusion. To titrate your infusion, press the Titrate key located just below the lower right-hand side of the screen. Change the rate to 125 milliliters per hour and press OK. Notice the rate advisory indicating a large change in the rate. Please make sure that you read all advisories. Press Yes to accept the change. To run a bolus of fluids, press the bolus soft key located just below the lower left-hand side of the screen. Enter the amount 250 milliliters. Press OK. Enter the time in minute, second, 1501. Press OK. You must add the additional 1 second because the pump will not run a bolus at a rate greater than 999 milliliters per hour. Press Run Stop to start the bolus. You should hear the pump delivering the bolus. To cancel a bolus, press the Cancel soft key just below the lower left-hand side of the screen. This returns the rate to the previously programmed rate. When running a secondary bag with these pumps, it is important to understand they will only deliver one fluid at a time, and the pump will pull fluids out of the bag based on gravity. Make sure the secondary bag of fluids you want to deliver to the patient is hung higher than the primary bag. We are going to program a secondary bag of cefazolin, 2 grams in 100 milliliters, over 30 minutes. Press the Run Stop button to program a secondary bag. Press Review Program soft key. Press Program Secondary soft key. Enter CE using T9 texting then use the down arrow to select cefazolin. Press OK. Use the down arrow to select 2 grams and 100 milliliters. Press OK. Notice the confirmation concentration notice and press Yes. Notice a secondary bag is highlighted at the top of the screen. Press OK. Confirm the dose, grams per hour, is 4. Press OK. Confirm the VTBI is 100. Press OK. Rate and time will automatically fill. Please review these numbers to ensure they match your order. Once the secondary infusion is programmed into the pump, you may attach your secondary fluids to the port above the pump channel. Make sure you release the roller clamp or the fluids will pull from the primary bag of fluids, and the pump will not warn you this is occurring. Press Run Stop. Review the Check Flow pop-up and ensure drips are falling in the secondary chamber. Press Yes. Your secondary bag is now infusing. Press Run Stop to cancel the secondary infusion if needed. We will now program the IV pump for titratable infusions, but first we need to clear the program. Press Clear Program. When prompted to cancel primary, secondary, or both, choose both. Confirm clearing of the program by pressing Yes. Use the up or down arrows to find Special Care Area and select OK. Enter DO using T9 texting for dopamine. Use the down arrows to select dopamine. Press OK. Enter a weight of 75 kilograms. Press OK. Change the starting dose to 10 micrograms per kg per minute. Press OK. Agree to the rate advisory by pressing Yes. Review the VTBI and press OK. Now press Run Stop. Dopamine is now infusing. To titrate dopamine, press the Titrate soft key. Notice to the left of the 10 there are soft parameters, 0.5 to 20 micrograms per kilogram per minute. We will now test these soft limits. Enter 21 micrograms per kg per minute into the pump. Press OK. There will be 2 alerts. The first is a warning the rate is outside the soft limits for the drug. Press Yes. The second warning is a rate advisory indication that the new titrated rate of the drug is a 110% change from the previous rate. Press Yes. Now notice how the color of the numbers on the pump have changed from black to red. Any pump running outside of the soft limits or in basic mode will have numbers indicated in red. Anytime you see red numbers, it should be a red flag for you to confirm your orders and ensure the pump is programmed properly. Remember, basic mode should only be used when a pharmacist has programmed the IV pump with you as a witness. Basic mode should be used on extremely rare occasions. Now we are going to titrate the rate to 51 micrograms per kilogram per minute. Press the titrate and enter 51. Press OK. Notice the pump will alert you that the rate is above the facility hard limit of 50 micrograms per kilogram per minute. If you ever need to lock the IV pump, enter 429. It spells key. This locks your pump from unwanted interventions by patients or family members. To unlock pump, re-enter 429. To discontinue an infusion, press Run Stop on the IV pump. Use the slide clamp to open the pump door and remove the IV tubing. Close the door and press On/Off button to power down device. Dispose of fluids by following facility guidelines. You're responsible for clearing all medications from your room when a patient discharges. Environmental services will not touch any fluids on the IV pole. Now a few reminders about these IV pumps. Remember, if a secondary bag is programmed, the lower hung primary bag of IV fluids will be paused during the infusion of the secondary bag. To avoid disrupting primary IV fluids to the patient, please obtain a second IV pump when necessary. Also remember to keep the IV pump plugged into the wall whenever an outlet is available.